This meeting is being recorded.
Ashika? Yeah.
Yes, ma'am. Good evening to one and all. So, welcome you all to Homeovision webinar series organized by All India Homeopathic Student and Youth Association. So, today's topic for this live webinar is Role of Homeopathy in Autism Spectrum Disorder. And we have with us our guest speaker, Dr. Meenal Pravin Berad. She is professor and HOD from Department of Homeopathic Repertory from Shri Bhagwan Homeopathic Medical College and Hospital Chatrapati Sambhaji Nagar. And she has done her MD from Shri Bhagwan Homeopathic Medical College and Hospital, and she is PhD scholar from Guru Mishri Homeopathic Medical College, Jalna, and she has 12 years of teaching experience, and she has successfully completed the advanced course in health science education technology from MUHS Nasik in 2017. She is also resource person for basic workshop in HSET at homeopathic colleges under MUHS Nasik. She is resource person for basic workshop on research methodology too. She is examiner, paper setter. She is in charge of homeopathic department of internship at Shri Bhagwan Homeopathic Medical College, and she is a member of curricular committee in Shri Bhagwan Homeopathic Medical College too. So we all are eagerly waiting to hear from you, ma'am. Over to
Yes,
you, ma'am.
yes. Good evening, everyone. Sorry for the uh, inconvenience from my side. Am I audible now? Hello?
Yes, ma'am.
Yes, ma'am, audible.
Okay. Yes. We'll start with the presentation now. Today we will be discussing the autism spectrum disorder and its homeopathic treatment. Okay. So first of all, what is the objective of this session? To know the autism in detail. This is the autism spectrum disorder. It is why it is called a disorder, because it includes many problems. To know the autism in detail and to study the role of homeopathy in autism. These are our objectives. In this session, we will be discussing about the symptoms of autism, signs of autism, causes of autism, and autism in older children, and role of homeopathy and cease therapy for autism along with the homeopathy. It is related to homeopathy, so we will discuss about it. So now, what is autism? It is a disorder and condition related to brain development. There is no pathological cause. The complex developmental disability that typically appears during first 3 years of life and is the result of neurological disorder that affect the normal functioning of brain, which affect development in the areas of social interactions, communication skill, and normal development of the child, which occurs during first 3 years of age. Autism spectrum disorder may cause difficulty in functioning in various aspects of brain. It affects the children, shows the symptoms within the first year of life. The small number of children with this condition may develop the symptom later, but the first 6 months of life of every child is very crucial. There is no cure for autism in allopathy because they just advise therapy, as there is no pathological cause for this disorder. There is no structural changes or pathology in brain, but only functional level it is having only disorders and affections in the functional level of brain. Now we will see what are the causes of autism spectrum disorder. No one exactly knows what are the causes of autism spectrum disorder, but there are other causes like genetic and environmental factors which play important role. It was previously believed that stress and psychological effect in upbringing and even the upbringing by the parents may cause the autism, but it is not related to the main cause. The experts have found that there is no single cause. There are combination of genetic and certain other causes related to pregnancy, labor, and delivery. There are many environmental factors and prenatal events which occurs and may cause the autism. Following are the factors which are the probable which may cause the autism. First, becoming pregnant above the age of 35. That is primary elderly gravida, which we call after the age of 35 agar pregnancy hai, so it may cause autism. Then second baby within 12 months of first delivery. Then gestational diabetes. If the mother is having gestational diabetes, it may cause autism spectrum disorders. Reduce oxygen to the fetus during pregnancy and delivery may cause autism. And it is a syndrome. There are different causes which are applicable in different cases. Some are the metabolic disorders which may cause autism. For example, many cases of autism are known to have problems with copper metabolism. Some kids may have food allergy which play important role. Many autism patients improve on gluten-free diet or casein-free diet if given. This has given rise to the notion that autism may be related to food allergy. Next is epigenetic. There is an increasing amount of research that the autistic changes may be precipitated during the epigenetic changes induced either by physical, mental, chemical exposure to pesticides, preservatives, food colors, pollutants, or other infections during pregnancy, viral infection, chicken pox during pregnancy, nutritional deficiency during pregnancy, or various vaccinations which are given during pregnancy may cause the autism. Some genetic factors are there. Autism spectrum disorder has a strong genetic component and it is evidenced by high evidences between the siblings. If the siblings are having autism, there are 80% chances of having second baby autistic. Some environmental factors like advanced age of mother, then exposure to certain type of anticonvulsive and antidepressant medications taken during pregnancy, then exposure to toxins, air pollution, pesticides, heavy metal may cause autism. Complications like prematurity, low birth weight, oxygen deficiency to the brain during delivery, IUGR, intrauterine growth retardation, may cause autism spectrum disorder. Some neurobiological factors also play important role, like brain growth. First trimester of pregnancy is very, very crucial. The excessive brain volume and growth in first year of life, followed by slow down and potential decline during adolescence and childhood, may cause autism. Some other factors are neuron to ganglion ratio. in certain brain regions, particularly prefrontal cortex. The ratio between neuron and ganglion, if it is altered, it may cause autism spectrum disorder. Then second cause is neural disconnectivity. Alterations in the connectivity between different cortical regions and between hemispheres, potentially affecting the integration of information. Then synaptic alteration, abnormalities in the number, structure and functions of synapses, the connections in between the two neurons may cause autism spectrum disorder in first 6 months of life. Some neurotransmitters also play important role, like alterations in neurotransmitters like serotonin, GABA, glutamate, which play crucial role in the brain development and functions. It is important to remember that factors like infections and bad parenting and specific dietary choices, specific type of food if eaten by the kids, may cause autism spectrum disorders. Now we will see the interplay between genetics and environmental factors is highly complex, and specific mechanisms underlying the autism spectrum disorder are still investigated. It is important to remember that factors like vaccines and bad parenting or specific dietary choices may not have shown any cause in autism spectrum disorder, but it is not proven. So they may cause. Signs of autism spectrum disorder from birth to 6 months in children, but which are later diagnosed autistic. The first sign is flaccid body tone. Second is lack of responsiveness and attentiveness to the people or things. Third is lack of excitement in the presence of parents. They don't identify their parents. Lack of anticipatory posturing on being picked up. Vacant, unfocused gaze. They do not give response when their name is called. Less than normal activity. Then specific motor deviations. Eye squint mannerism. Predominantly irritable mood. Little smiling. The kids are more sleepy, drowsy than the typical child. First symptom of autism typically noticed in between 6 to 12 months. There is a hallucinatory excitement, appearance of self-absorption, no visual pursuit of people. They do not have eye contact with the people around them. Avoiding mother's gaze. The child will not look at the mother. Persistent being held away from parents, resisting being, they do not have any resistance, they do not identify their parents, so even if others take them, they do not show any resistance. Hand flapping, finger dancing movement, rocking and spinning. Plastic expressions, that means they do not give any expression or they do not communicate by expression. Zero facial expression, that shift from grimaces to squints. Fragmented, uncoordinated body movement. Episodes of failing, aimless, unmodulated hyperactivity. The symptoms of established autism typically in between 12 to 24 months. Child doesn't approach parents. Child keeps distance from parents. They may not be, the child may be more sensitive to certain type of sound and textures. They may seek specific sensory experiences, that is deep pressure and specific textures, repetitive movements, hand flapping, rocking, incoherent talk, not related talk, babbling and other sounds, moaning type of sound. They like to play alone, difficulty in initiating and maintaining any social contact, limited, they don't want to play with their siblings. Now we will see the symptoms of autism in older children. They repeat the same words or phrases over and over again and again. They does not know how to make friends. They does not want to play and connect with the people. They use language incorrectly. They does not pick up on other person's expression, tone or gestures. They show no interest in what is going on around them. They follow rigid routine. They don't want to get disturbed in their routine. They do not tolerate of being touched, carried or held. They cannot understand the feelings. They has a trouble in talking about the feelings. They do not share interest or achievements with the others. They repeat the same action or movement again and again, does not make any eye contact, unusual attachment to the toys or any pets. If anyone takes their toys, they may cry or throw the things or even beat the other person. They may play with their fixed toys. They don't want to change their It gives unusual reactions to the sound, smell, sights, textures, and may show sensitivity to the loud noises, and they have aversion to the change. Both children and adults with autism typically show difficulties in verbal and non-verbal communication, social interactions. And play activities. Now, homeopathic treatment, autism and homeopathic treatment. Homeopathy is one of the most popular holistic system of medicine. The selection of homeopathic medicine for autism is based on individualization of symptom similarity by using holistic approach. This is the only way through which a state of complete health can be regained by removing all the signs and symptoms from which the patient is suffering. The aim of homeopathy is not only to treat the autism spectrum disorder, but to address its underlying cause and individual susceptibility. As far as therapeutic medication is concerned, several homeopathic remedies are available to treat the autism spectrum disorder that can be selected on the basis of family history, elements from that is what is the cause of autism, then sensation, modalities, and concomitant. Following are the homeopathic medicines which are used to treat the autism spectrum disorder. First is agaricus. Agaricus muscarius. The children who cannot remember, make mistakes, and are slow in learning. The child sings, talks, but does not answer. Singing, shouting, and muttering in rhymes. The child is loquacious. Autism in children who are who talks unintelligently, continuously changes topics. Twitching in muscle is marked symptom. Autism in children who has aversion to work, does not want to do his daily household task, talks continuously and jumps over from one topic to another, sings, talks but not answer, indifference, great mental excitement and incoherent talking. These are the symptoms from on the basis of which we can give agaricus to the patient having autism. Second medicine is barataka. The patient is having weak memory, shyness with low confidence, the patient is physically and mentally dwarf, tendency to recurrent tonsillitis, very sensitive to cold air, cold weather, low self-confidence, shy, bashful, aversion to the stranger, loss of memory, mental weakness. Barata carb is an excellent homeopathic remedy for children with autism who have low IQ. The patient behaves having low confidence. They are backward physically and mentally. They are having aversion to meeting strangers. Children subject to throat infection. These are the symptoms. If present, we can give Barata carb to the patient with autism. Second medicine is carcinosin. It is a wonderful homeopathic medicine for autism spectrum disorder. Child is affectionate, sympathetic. The child is having hyperactivity, which is very much marked in carcinosin patient. Autism in children with family history of cancer or strong history of diabetes and coronary artery disease, or both, may have interest in artwork like drawing, singing, coloring, etc. The child is mild, yielding, and sensitive to reprimands. Next medicine is calcarea phos. The patient is anemic. The children who are peevish, irritable, having strong desire to go out. Autism with recurrent tonsillitis, adenoids, pain on opening the mouth. Infant want to nurse all time and vomit easily. Autism with mouth breathing and craving for salted smoked meat. Then we can give calcarea phos. Next medicine is AIHSAYA. There is low muttering speech. The child is very suspicious, talks always in muttering, wants to talk, foolish, inclined to laugh at everything with deep stupor, quarrelsome, uncovers body, purposeless movement, no love for near ones. AIHSAYA can be the remedy for autism. Next is calibromatum. In this patient, when the child moves purposelessly, flapping, loss of memory, can pronounce any word told, but cannot speak. Night delusion, horrid illusions. Then calibromatum is the best medicine for the autism. Next is lycopodium. The child is having anticipatory anxiety, anger, violent, irritable child, obstinate, desire for the sweet and warm food, intolerance for cold drink, anxious child especially appears in public, obstinate, domineering, does not share things. The child is having anticipatory anxiety. The child wants to live alone. The child is having aversion to company, but needs someone in the house. The child is anxious, especially when appearing in public. If autism with this type of symptom are present, lycopodium is the best medicine. Next medicine is phosphorus. Autistic child who is very affectionate, friendly, but physically The child is having constipation with hard stool, restlessness, fearful, desire for cold drink, ice cream, and cold food. The child is mild, cheerful, but sometimes have great fear. Fear of thunderstorm, fear of alone, phosphorus. And if, along with all these symptoms, if the phosphorus type of constitution is present, then phosphorus can be given for such autistic child. Next medicine is silicea. When autism develops after vaccination, silicea is the best medicine. The child is having fixed ideas for everything, very obstinate, constipation, very sensitive to cold weather. Autism with defective nutrition cannot assimilate what has been eaten by the kid. Autism with profuse sweating on the palms and soles. Child is very obstinate, concerned about everything. Silicea is the best homeopathic medicine for autism in children who are intelligent but who are very sensitive and obedient. Next medicine is tarantula. Hyperactive child, extremely restless, must keep in constant motion. The child is having aversion to company. The child moves from one place to another place. Child likes bright colors, likes music, like dancing, always full of energy, cannot sit on one place. This tarantula is the best homeopathic medicine for autism spectrum disorder, which is having destructive behavior. If the child is having destructive nature with sudden changes in mood, extreme restlessness, hyperactivity, must keep in constant motion, then tarantula can be given. Next medicine is helleborus. Helleborus is very useful medicine for the autistic children who have reduced sensitivity to pain. The patient do not complain anything. They have reduced their sensitivity to pain and temperature stimuli. They don't feel pain, they don't feel temperature stimuli. Then helleborus with autism symptom. Then helleborus is the best medicine. Next medicine, some other specific remedies for the autism are stramonium. It is very useful remedy for the children having fearful behavior, night terror. It can promote a sense of security, helping children feel safe in their environment. So stramonium can be given along with other physical symptoms if present. Next medicine is natrum mur. This remedy is useful in emotional kids. They always want to hide their sadness. They don't want to express their emotions in front of others. So natrum mur is very useful in improving the social interactions autistic children. Next homeopathic medicine is phosphorus. It helps to promote the social interactions in autistic kids. Phosphorus can help the children become more open and engaging in social activities. Now, what are the doses and administration? Consultation with professional. It is crucial to consult a qualified homeopathic doctor and take the proper individualized homeopathic medicine. How the potency is selected? It depends upon the severity of the symptoms, and susceptibility of the patient. Regular, continuous assessment and follow-up with homeopath are important for monitoring the progress. Autism is curable with homeopathy. Case studies and evidences. Numerous case studies highlight the positive outcome of homeopathic treatment in children with autism, showcasing improvements in behavior, communication, and skill. There are many cases and many evidences which show the homeopathic medicines have treated successfully autism. There are many clinical research done to show the efficacy of specific homeopathic medicines for autism. Complementary therapies are also useful, like counseling therapies for parents, enhancing their effectiveness and providing more comprehensive treatment plan. Next is cease therapy. Apart from these homeopathic remedies, another therapy in the homeopathy used for autism is cease therapy. It includes the use of individualized remedies like potentized vaccines or any other drugs which are taken by the mother or the kids in first 6 months of life or during pregnancy. If the mother was taking particular type of medication during pregnancy, may it be thyroid or anti-diabetic medicine, so these drugs can be potentized and can be given to the child having autism, of the mother who has born such type of autistic kids. So we can potentize those medicines and give it to the kids, because the cause of autism may be the drugs which the mother was taking during pregnancy. It has been mentioned in Organ of Medicine aphorism, footnote number 164, that you can use such a type of medicines for treating mental diseases. He has not mentioned particularly autism, but Dr. Hahnemann mentioned about the mental illness and other chronic diseases can be treated by potentizing the individualized remedies and vaccines which are taken by the mother. And after potentization, that medicine can be given to the kids to treat the autism. Some special remedies like cuprum cum carcinosin is newly proved remedy which is very useful in cases of autism in the kids which are having family history of carcinoma or family history of any malignancy. Along with it, a high dose proper supplement of vitamin C, zinc, copper, omega-3 fatty acids are given. In our experience, classical homeopathy, where the homeopathic medicines are selected on the basis of symptom similarity and proper similar medicine should be given. These are the best for autistic children. Some other autism therapy includes occupational therapy. That means the kids are given some type of task, some type of play, toys to play, so that their concentration will improve, their communication will improve. Applied behavioral therapy can be given simultaneously along with homeopathic medicines. Speech therapy is very useful. Nutritional supplements, I have already mentioned multivitamin, omega-3, and special type of education. These are very useful in case of autism. Thank you.
Thank you, ma'am. Thank you so much for the wonderful session. Dr. Ashika, kindly continue.
Yes, yes, yes.
Dr. Ashika. Thank you, ma'am. Thank you so much for the wonderful session. So, respected participants, if you have any doubts, so kindly comment in the comment box so that madam will be answering. Yeah.
You can ask, unmute and ask.
Hope they were clear with the topic, ma'am. Yes, ma'am. So, we will wrap up the section, ma'am. Um, I hope there is a question. Yes, ma'am. I think they were clear with the topic, ma'am. So that we will
Yes,
be
yes.
wrapping up the session, ma'am.
Okay.
Uh, Thank you, ma'am. Thank you so much for the wonderful session. And thank you all the participants. Looking forward for many sessions, ma'am. So
Thank you.
thank
Thank
you
you.
all. Thank you so much.
Thank
We'll be
you.
right back with the many more sessions. So thank you all. Yeah, ma'am.
Thank you. Thank you very much.
Thank you, ma'am.